Hello, everyone. This is our briefing. The first thing I'd like to start with is we've got another hotspot in another county, a county that kind of wedged in between a couple of counties that we already had hotspots, and that is Marion County. And I am issuing an executive order today to bring those into the other 7 counties that we have. We need to watch very carefully in Marion County and observe all the things that we're already doing in the other 6 counties. Again, I'd like to just go back to just this. To date now, our total cases of positive versus total cases tested are running at 3.68%. Now that's great. But remember, yesterday we were at 3.42. We had I think 50 additional positives come in last night, and not that many additional tests. And so these are going to not correspond directly, with one another always. But the bottom line is we're still trending. We're trending in a good way, and we need to be able to keep up everything that we're doing, stay the course. We don't have any additional deaths, thank God for that and everything, but we still got some sick people that are out there, and we need to keep them, as well as those that have passed away, all their loved ones and everything, in our thoughts and prayers, and we just need to stay the course. Every day that goes by now is a monumental hurdle, because we know we're close to being in the eye of the storm. And the eye of the storm is close to over top of us. It still may be 5 or 6 days away, or it may be here right today. It may very well at some point in time get a tremendous amount uglier. We don't know that. We should still be very concerned, but at the same time, we hold hope that there is light at the end of the tunnel, and things are going our way to look like they're going to get better. Still got a long ways to go. Still be very, very concerned. Still know that none of us know. Only God above knows, and He'll get us through this. I absolutely am confident about that beyond belief, but it's still, there's tons of sadness out there, and you've got to really stay on guard. Now, as far as, let me just see, I've got, this is dear to my heart, but dear to all of our hearts, and it's just this. We've still got over 7,000 kids in West Virginia that are in foster care, and it is imperative that we continue to recruit foster care parents. Now, we have to have classes for those potential parents, and that basically gives them online training and everything, and for foster caring, or the foster caring of kids. So with that being said, because of this shutdown in every way, there's a lot of you that are out there that think, well, the foster care system's shut down because they can't have any classes, and they can't do the work to be able to certify us as potential foster care parents. Well, it's not shut down. It's online. And we have those online classes, and so please, if there's a time in life when you feel the calling to be able to step up and to be able to help take care of a child, nothing that could be more important. So please go online and look at the possibility of being able to take care of some of these kids. I want to commend our Department of Education. They keep on just doing more and more great stuff. The schools and career technical education centers are now donating in excess of 65,000 protective items to the healthcare workers and first responders. It's unbelievable, all the great stuff that they're doing, from the standpoint of, producing face shields and masks and just all kinds of protective, equipment and everything that they're doing. Listen, our educators have been superstars beyond belief, and that's all there is to it. Led by Clayton Birch, who's doing a fabulous job, but all of our teachers and the service personnel and all the people that are in the education community, just think what they're doing. They're doing online learning right as we speak right now. That is monstrously important. They are participating in feeding thousands and thousands of kids. The other day, we were here probably, a week ago, they had fed 1 million meals. And now they're out making equipment and everything, protective equipment for all of our healthcare and first responders. So you got to salute them and commend them. They're doing great work, and I just love them with all my soul. So thank you so much. And just a few more announcements. I'm trying to go as quickly as I possibly can. One gentleman that I'd like to bring up, because the other day, I said Jeff Kessler called, and he gave me a number of a gentleman. I called this gentleman. This gentleman is Brian, and I'm going to mispronounce his last name, so forgive me, Brian, but Shamball. And Brian was a former commissioner, in the northern part of the state. So I talked first to Brian. Brian, right off the get-go, says, Brian, I'll donate X number of the mask and everything, and I'll donate to this cause, because he wants to stand up and do the same thing. And so then he contacted me, then he gave me another number of a doctor that we basically were able to order a great many masks and protective gowns. So that was really good. General Hoyer is going to talk about this in just a few minutes, but I want to thank President Trump for approving my request for FEMA to fund 100% of the emergency assistance activities for our West Virginia National Guard that's undertaken all this great work, in this COVID-19 deal that we got going on. There's another company that's really stepped up, and this is a company that's part of United Health, and they're Optum. And they are offering now, that they're going to have a call line set up for emotional and support help that is totally free to all West Virginians. And this is a free service, and we're going to put it up here on the screen. I think, that it's a 24/7 service, and take note of that, and we salute Optum and all the great work that they're doing. And if you have a need, from the standpoint of any level of stress or anxiety or worry about all the stuff that's going on and all the stuff that's around you, please call these people, and these people will have someone that's an expert in this field that'll be able to talk to you and maybe assist in different ways. The Wayne County Nursing Home, we now have a positive test in the Wayne County Nursing Home. The patient's been being treated at a local hospital, and naturally, we send our thoughts and prayers out to them and that individual, and we'll monitor everything there to try to move that situation along where we don't have further contamination and further issues there. I guess just a couple last cleanups, and one is just this is, in every single thing we do, and this is how I've tried to, I can't say it any more simple than just this. We want you, the public, to have every thread of information and have complete transparency. This is me. Total transparency to everything that's going on. Now, in all of that, we can't violate HIPAA regulations and that, because, we can't do that. But I want everyone to know exactly where I stand. And if it comes to me, that's what I'm going to do. DHH and the National Guard are working together to gather additional support data and everything that they're going to start real soon. I think Clay Marsh is going to talk to you about that today. And the last thing that I'd end with, and is something that's a little bit on a humorous note. I really do truly believe that the good Lord gave you the ability to smile and to laugh, and in these times, we need to try as best we possibly can to heed to Him in prayer and in some way, somehow, just keep ourselves going. You know, this came to me this morning, you know, through Metro News. I was asked about, you know, that FanDuel had come out and said, you know, that they were going to be able to take bets on the presidential election. And I thought, you know, are you kidding me? You know, the first thing that came to my mind was, you know, what next? I mean, and how ridiculous that could be. And that's exactly what I said on Metro News. But then come to find out about it, that someone, you know, in our lottery commission and everything has basically approved this. Well, the very second that I found out about it, I disapproved it, because we're not going to do that. I mean, that's absolutely ludicrous. We're not. I mean, that is just, it's humorous, but it's ridiculous. So that's about all I've got to report today. And again, I would just tell you, West Virginia, you're doing a great job. Stay the course. As long as we can keep that percentage level under 4%. In fact, we want it to just drift to 2, from 3 to 2 to 1, and then be gone. You know, so West Virginians are doing a great job. We still got a ways to go. Take this very, very seriously. Be concerned, but let's be hopeful, and let's be great, great people of God, in that we're very hopeful that this is going to pass, and He's going to give us the ability for this to pass. But thank you so much.
Thank you, Governor. First, we're going to take some comments from a few of our panel members. Up first, Dr. Clay Marsh, our coronavirus czar.
Well, thank you, Governor, and it's great to be with everybody today. I think the Governor has given us very clear instruction. We want to be proud of what we're doing together, but we also want to not be complacent. We know that from the national news that the state of California is being urged in the next 2 weeks to try to stay home in all possibilities. If they have to go out, they need to go out for a very short time, because what they realize, and what we should realize as well, is that as the projected peak of the COVID-19 or novel coronavirus is coming up, then the staying physically separated and staying at home has the greatest impact in the next 8 to 14 days. So ultimately, it's really our time right now to double down, to make sure that we are protecting ourselves and protecting each other by staying separated. It's interesting that an article came out yesterday through the Centers for Disease Control that looked at the way that the COVID virus expanded in China. And what they found was, as opposed to what we had believed previously, that a single person infected with the COVID-19 virus would likely infect 2 to 2.5 more people, that in the experience in China, they found that a single person there was likely to infect 5.7 people. And so that compounding benefit to the virus means that the virus is even harder to suppress, harder to keep from spreading quickly. So it means if we let our guard down and we say, oh, it's good, we've done well, then the chances are that the virus will start spreading here in West Virginia in a faster rate. And as the governor said, we now know that there's an additional hotspot. And we understand that the virus is in West Virginia like it's everywhere else, but it's really, really critical. And the investment today of physically separating and staying at home will be seen over the next 8 to 14 days. So every day coming up becomes really critical for us. So while we're really happy and grateful for the great work of most of our citizens, we're going to call on you to be even more diligent about what you're doing. The governor also mentioned, and this is something that we're getting a lot of feedback from the community and the media, that there are some additional pieces of information that they want us to share. For instance, what's happening with the people that have been found to be COVID positive? What's their status? And when we look at the data, not only what percent of the people tested are positive, but what is the rate that we're seeing of people being tested now? And I think that there's two caveats, but we are committed to bringing this information to the public. But the two caveats are that we are having to pull a lot of this information really from General Hoyer's team, John Wiles being the lead, on a county by county basis. So we know that this is as accurate as we can get it, but we are continuing to try to create more automated systems to make it even easier to report this data. And we also know that if we look at how many tests have returned positive on a certain day, that does not represent only the test ordered on that day or the day before. Some of the test results take 5 to 7 days or occasionally even more. So some of this is coming from a time that is maybe a week old. Now, on the DHHR website, we have the test results organized by the day ordered, and we'll add some more information that will let people see what our county health people are seeing on a particular day. So we want to put more information out there. We want to make sure that people do understand that everything that we do does have some limits, and we continue to try to improve how we're gathering the data, working with Secretary Crouch and Commissioner Slimp, and certainly the National Guard that's doing an amazing job. But we plan to push more information out, and we want to get feedback from our community about, does that satisfy? Is that good? What else do people want to see? And within the bounds that we can, we will try to get that information out there. So with that, that's my comments, and I'll turn it back over to you, Governor.
All right, thank you, Dr. Marsh. Next, let's go to Major General Hoyer with the West Virginia National Guard.
Good afternoon. Today we have 540 National Guardsmen on duty. As the governor mentioned, the governor's request for federal 100% reimbursement and federal status for the National Guard remaining under control of the governor was approved. That's referred to as Title 32 502F status. What that does is allow for 100% reimbursement of the National Guard personnel for a 31-day set of orders. In addition, it provides additional health care, and should a member of the Guard be injured, it would prevent the use of workers' compensation and put us under a federal status. Exceptionally important to our Guardsmen on the front lines of this effort. In addition to that, the second call center was stood up at Workforce West Virginia. An additional 19 personnel from the National Guard are involved. We'll be up to a total of 30 personnel in the next 3 days. Tonight at 6 p.m., a communications test will occur with the call center at West Virginia University. If that test is successful, the third call center will stand up tomorrow morning as directed by the governor. We continue to make vast improvements working with our partners at Workforce West Virginia to meet the governor's directive of taking care of the citizens of West Virginia. Yesterday, 27 additional retail locations were trained. Today, 43 retail locations are taking training. Later on today, in our West Virginia National Guard press release, also attached with that will be some sample documents of us, documents we've worked with our local health department partners to put out information to the public and to provide guidance to those retail locations. In addition to that, we have, with 100 National Guardsmen working with our food bank partners, have put out over 60,000 meals. And we have a video we'd like to show you of some of the great work being done by the Guard folks, the volunteers at food bank, and the food bank staff. If you could, please roll the video.
West Virginia National Guard's mission today is to help lead children.
Our mission is to ensure that all of the souls that live in our 17 county service area do not have to struggle to have enough food to eat.
Our organization serves 48 of the 55 counties by providing food to food pantries, soup kitchens, feeding organizations throughout West Virginia.
I mean, pure and simple, there's plenty of children out there that rely on school breakfast, school lunch throughout the week.
What we're doing here today is making boxes of food for people around the area in support of the coronavirus and ensure that they're being fed for the upcoming months.
The National Guard is here and they are phenomenal. They are working to build food boxes for us. They've been working nonstop this week. It means a lot to have their support because they're supporting not only Mountaineer Food Bank, but they're supporting our West Virginia communities here and making sure that we have the boxes that we need to feed hungry families in the state.
It's important to have Guard resources here because it helps augment the civilian workforce, and by us being out here, it's just having a positive ripple effect.
There's a need that needs filled, and we're filling it.
So on behalf of Governor Justice, and I would like to thank all the men and women of the National Guard participating in this effort, as well as our partners and volunteers at the food bank for the great work that they're doing to take care of our citizens. In addition to those things, our team supporting Department of Health and Human Resources epidemiology efforts, as well as the county health department epidemiology efforts in the past 24 hours have conducted 205 engagements working on contact tracing to help address this threat that we face. In addition to the work that you saw with the food bank, we will have an additional 5 to 10 National Guard personnel, starting out with 5, to assist with additional food bank surge efforts that are required. Again, on behalf of the governor, I want to thank all the National Guardsmen, all of our partners with all the state agencies, and all of our first responders, medical providers for the great work. And again, thank the citizens of West Virginia for doubling down on this effort as we get through this next phase of this event. Thank you.
General, I've got to say this, and I want to say this to all West Virginians. First of all, I hadn't seen that video until just right then. And I mean this from the very bottom of my heart. It brings real tears to my eyes because the Guard is so essential to us. And what they're doing is unbelievable. It's just unbelievable. I mean, not to take lightly, look at all the unemployment claims that they're being able to assist Workforce West Virginia and being able to really get those people their benefits and get them faster. And look at them out there, actually bringing, manning our food banks and helping in every way there. And I know there's so many others that are out there helping. But I mean this, if you're a young person in this state and you don't think seriously about joining our Guard, there's something wrong with you because they're absolutely superstars. And I want every one of us right this second in all your homes, let's at least clap and cheer for them because they're doing an unbelievable service. So thank you, and God bless them all in every way. General, you are an absolute superstar, and thank you so much, sir.
All right, thank you, Governor. Next, let's go to the West Virginia DHHR with Secretary Bill Crouch and Dr. Kathy Slim.
Yes, good afternoon, everyone. We've had several inquiries and questions about other services. I want to make sure that as we navigate through this pandemic, that we don't forget all of the other services DHHR provides and make sure our citizens know there is still access to those services through a variety of means. I believe there will be some numbers on the screen at some point during this broadcast to make you aware of those. As much as we can do in terms of other services is now done through video or audio conferencing, but there are a number of services that cannot be done online or through video. So I want to thank those employees of DHHR and of the state of West Virginia for continuing those services to make sure our child welfare services and our adult protective services and our state facilities in West Virginia taking care of individuals who need us. I want to thank our staff for doing that in a difficult time. I appreciate what they do, and we want them to keep our citizens safe and also keep themselves safe. So thank you.
We've had some questions around lab testing. And interestingly, when in the rare occasion or in different occasions in which someone's test may go from negative to positive or positive to negative. And so there's several factors that fit into that. One is simply the disease course. Is it too early to pick it up, or have they cleared the virus? And those kind of things can change those results as well initially. Also, there are specimen collection and laboratory issues that can impact that. They are very rare, but that can occur. And then the third thing is no laboratory test, regardless whether it's COVID-19 or otherwise, is 100% perfect. And they all have their strengths and they have their limitations. And so that's where you will occasionally have some false positives or false negatives or other issues that arise. The key thing is that all of our providers and our laboratorians and epidemiologists really put the laboratory testing in the context of the setting and the clinical picture, and then make sure that they get the right actions and results that follow from it. So that was that issue. These tests are evolving, as you know, around the nation. And so they are getting more and more accurate and effective as they are continue to be evolved, but that takes some time. The second area was just wanted to speak to the fact that we are working closely with local health officials on the community mitigation measures, and really appreciate their leadership in that. And also the support we've had from the National Guard in working with those counties, with those businesses, as you heard from General Hoyer. And then the third area is we continue to support and work with local and regional epidemiologists in several community and facility outbreaks, kind of just supporting them in that work. And again, the National Guard is a great asset in implementing and providing some workforce in some of those. So we appreciate that. And I just wanted to say thank you to both our local and regional and state and National Guard staff that are really working so diligently to really address what are complex situations at many times and difficult investigations and really getting that done. So thank you to all of them.
All right, thank you. Once again, we are holding today's briefing with media members joining us virtually to practice good social distancing. The first questioner we have today is Stephen Allen Adams with Ogden Newspapers.
Yes, this is Stephen Adams of Ogden Newspapers, and this is for the governor. And since you opened the door for it, I have to ask, in regards to the election betting that the lottery approved, do we know when they approved that, why it was approved? State code seems to be pretty explicit that wagering on elections is illegal, and it's a misdemeanor if you're convicted of it. So do we know exactly how this came to be and why this was approved in the first place?
Stephen, I did not know that. I mean, I thought it was just something that, that people were just fantasizing about, but I did not know at all until probably that it had been approved by someone in lottery until about 15 minutes ago, to tell you the truth. And but it will be addressed. It will be addressed very sternly. I have no earthly idea why in the world that someone would approve that. And not only that, I don't have any idea why they wouldn't notify the governor's office and ask the governor's office for some level of assistance, or some opinion as to whether or not that they should go with this. It is absolutely ridiculous. That's just all there is to it. We shut it down immediately, and we'll address it.
Okay, thank you. Up next, let's go to Charles Young with WV News.
Hi, this is Charles with WV News. Governor, with the the expansion of your executive order to include more hotspot counties, I was wondering if you could talk a little bit about the enforcement of these orders, any problems that we've seen around the state. I know that a judge in Kanawha County approved ankle monitors for folks that are resisting quarantining. What else have we been hearing, and might we see that in other counties?
I would really like for Brian Abraham to come up here and talk about this, but to my knowledge so far, there hasn't been any significant problems that I'm aware of at this time. I think people in general, you've got to understand that we expect people as much on an honor code as we can. We have put some real teeth into this thing from our medical community being able to monitor and then go and solicit help from our law enforcement community to be able to go and absolutely then direct these people as to what they're doing and that they have to stop or they have to go back to their homes or whatever the situation may be. And then if they don't, our law enforcement community knows that I'm urging them to go ahead and cite these people with obstruction, because this is life and death. That's just plain all there is to it. So we don't want to be terribly invasive, but we've got to be invasive to the point that people have got to listen and do what we tell them. But Brian, do you have anything to add?
We've received a handful of complaints here in the governor's office of non-compliance, and where we've done that, we've sent the West Virginia State Police out to look into those. Many of them have turned out to be unfounded, but when those were an essential business that wasn't conforming with the governor's directives, they quickly volunteered to redirect their conduct. So we haven't had any instances where law enforcement's had to get involved to the extent where they've enforced it with any kind of citation or arrest, save one that occurred early on in the Northern Panhandle. There was an alcohol establishment that the owner refused to comply with, and I understand he was cited. But by and large, the public has followed the directions of the law enforcement as they enforce the governor's order. But as we continue to receive those reports, we'll put those out and have those investigated.
Okay, thank you. Up next, let's go to Phil Kabler with the Charleston Gazette-Mail.
Governor, last week you alluded to the possible need for a special session to move some rainy day funds over to general revenue. Can you update us on the potential status for a special session, and have there been discussions on how exactly the legislature would meet in the middle of the pandemic?
Okay, Phil, I think I can handle this and everything. The situation, I think the number is $300 billion that have been allocated to the states. And the rules on that are supposed to be out on I think, maybe the 20th, the 21st, and then the actual funding is supposed to commence on the 24th. Now, here's the whole thing. I mean, if you look at it purely from an economic standpoint, here's where West Virginia is. West Virginia is going to run a deficit in this year primarily because of probably somewhere north of $350 million if we continue to be completely shut down for the balance of the year. Now, and meaning that revenues that were going to come in, well, they're not going to come in. That's all there is to it, because all of our businesses, everybody's shut down. Now, but of that $350 or $375 million delta, you've got $300 million of it is basically the deferment of our state income taxes that are going to fall into the next fiscal year. Now, that number could rise even a little north of where I'm telling you, but that's what you've got. Now, what we're trying to do as far as the special session is wait until we've got the rules and everything that come out. I may have misspoke and everything because, one of my people here is telling me the rules are coming out on the 17th of April, but after the rules come out, we'll know. We'll know at that point in time, are we going to have an influx of federal dollars that are going to backfill the revenue deficit? And if they backfill the revenue deficit, then there's no need to bring to go into any level of special session, whether you do it virtually or not. There's no need. Now, but if we see that there's not going to be, a backfilling of the revenue, and we're going to fall short, then we've got to bring people back some way or another. We know we can't bring them into a big crowd, and we'll have to figure out a way to do it, but we need to find out what the rules are first.
Okay, thank you.
Let me add one more thing, because this is pretty well out there and everything, and I don't want to put this carrot out there, and it seems so enormous it just blows us all away. But it's already out there enough, so I don't. Again, in an effort of total transparency, here's what can happen. On one of the calls, if you'll look at it from an economic standpoint, on one of the calls, the president, and we all know that there's $300 billion allocated to go to the states. Now, on one of the calls, the president clearly said that a bare minimum, and we've done all the research on this, a bare minimum that will go to each state is $1.25 billion. So we know if we can qualify that there is a minimum of $1.25 billion that could flow to West Virginia. Now, the problem with it is right now is one thing, and that is the way the rules are written today, the backfilling of revenue is not included. There's all kinds of other ways you can qualify for those funds and everything, but to be able to qualify to the magnitude that we want to be able to qualify, we need that rule change, and all the other states are pushing that and everything, and so we just got to wait and see what comes out of that.
Okay, thanks. Up next, let's go to Amanda Barron with WSAZ.
Hi there. Many of our most vulnerable are working at jobs that are essential jobs, places like grocery stores, superstores, things like that. I've noticed at some places there are still no protections in place for those vulnerable workers, like the shields that have been put up at some grocery stores. There have been no masks provided to those workers. I just want to know if it's incumbent upon the business to make sure that's done for their employees, or is it incumbent upon the state to make sure that those businesses are doing what's right by the members of this most vulnerable population?
Let me lead off, and then Clay, maybe you guys can jump in and everything else. But my answer to that would be, and I don't mean this in any smart alecky way, but the answer to that is yes. Businesses should monitor, and businesses should be screaming to the hilltops, for some level of assistance, whether they be shield or mask or whatever it may be. And our people may very well be able to supply that if we knew, that there was a need. Now, it may very well be that there are shortages of certain things that we couldn't supply, but I think that we're going to be able to assist and help. And from the other standpoint, and why I said yes to both parts, is it the business responsibility? Is it the government's responsibility? It's both our responsibilities. It's just that simple. So I'll defer now to our healthcare people.
Yeah, this is Clay. I would say, Amanda, that's a really important question. And we have really focused at trying to make sure that we are considering all of essential workers and first responders and people in harm's way, in whatever way you want to define that. Certainly the National Guard has been very proactive in trying to help train people who might be unloading boxes or who may be coming into contact with materials that they may have questions how to handle. But I think that as we look at our PPE supply, certainly we have focused on medical professionals and first responders, police, fire, EMT, but our essential workforce is also part of what we need to do. And the governor, in my opinion, is exactly right. We want the businesses to be proactive and make sure that they do supply what they can to their essential workers, and to be working in series with our teams to make sure that we are able to create the amount of personal protective equipment, not necessarily medical grade for people who might work in essential businesses like grocery stores or others, but to make sure that we both give them the materials that they need or instruct them so they can bring their own. A bandana, a scarf, something like that might be effective for certain types of people. Thinking about the barriers that exist, I think that's a really important issue, but also so that we train them so that they feel safer, that they can protect themselves. So I do agree with the governor. I think it's both.
Okay, thank you. Up next, let's go to Anthony Izaguirre with the AP.
Governor, are you considering expanding the virus hotspot restrictions to all counties just as a precaution?
Anthony, everything is constantly on the table, and everything is fluid as it can be. We've got a number of counties within our state that still don't have one positive test, and so I think, and this is just my opinion and everything, but I'm going to first and foremost listen to the experts and take their advice and very well probably decide what they're recommending for me to do. But at the same time, my feeling is just this: if we did a blanket all across our state, to me, it wouldn't be as effective as saying, here we got a real problem, let's do something about it. You know, and that's the one thing we don't want people to do in the area that is a real problem. We don't want people to take it lightly. We want the people to know just how important and how serious it really is. So to just do it blanket across the state, I don't know that we're prepared to do that, and I don't think it would be nearly as effective.
Okay, thank you, Anthony. Up next, let's go to Mark Curtis with WOWK.
Governor and all, it occurs to me that this is Easter week and Passover week, and these are the first holidays and holy days we've had since this crisis began. Obviously, a lot of places, most places of worship are closed and doing it by Facebook or whatever, but a lot of people travel during this time. What's your advice on traveling over the next week because of the holidays?
Mark, it would be the same thing. And again, I know I sound like a broken record, but just so there'll be many, many, many more Easters to come for all of us, we've got to minimize our travel. I know it's really hard in lots of ways. Easter's surely a time of year when all of us want to worship, and we want to worship with our family and our friends and all the people that we are attending churches with and everything. But this is such an unprecedented time that we've got to remember that if we can just some way stay the course, we're going to be okay. And if we don't, it can be really bad. And so just a few bad actors and everything can cause a lot of problems and everything. And we all need to be trying to embrace and look out after our neighbors. You know, the good Lord taught us to love our neighbors, we love ourselves and everything, and that's what we need to do. And so to minimize your travel, please do so. Try to stay at home as much as you can. You know, I know it's tough. I know it's really tough to do, and but that's what we have to do.
All right, thank you, Mark. Up next, let's go to Kenny Bass with WCHS.
Governor, with Kanawha County offering its first responders an extra $4 an hour in pay, many municipalities and counties throughout the state just don't have the resources to match that kind of financial reward or incentive for these people that are on the front lines. Is there any thought or possibility that the state could step in and offer some type of state tax holiday for first responders or people in certain job classifications during the entire length of this pandemic, at least while we're in stay-at-home order and lockdown?
Well, Kenny, I would be supportive of almost anything that we can do to better reward our heroes that are out there doing their jobs. But at the same time, I would bet too that the vast majority of our heroes are going to say, you don't have to do anything extra for me. I'm here to do my job. And that's just how great they really are, you know. And but I'll look into it. And one thing, Kenny, you've done, you've given me, you know, some suggestions about different things. You're a really sharp guy, and I've taken them, you know, I've taken them to the mat to check them out and see if possible, and I'll do that with this as well.
Okay, thank you, Kenny. Up next, let's go to David Beard with the Dominion Post.
David Beard. I'm fielding a question from some readers. Mon County is one of the hot spots. I think we had 68 positives this morning. People are wondering how we became a hot spot. Did it all come from the nursing home? Was it community spread? People failing to follow social distancing? Do you have any information on that?
Well, I'm going to defer that, but I'm going to let our medical community follow up on that. But I know what they're going to say. They're going to say, guys, this is everywhere. You know, to say all this came from a a bad situation at a nursing home, well, you know, I wish to goodness that we could all say, here's the one spot, and then we go fix the one spot, and then everything's fine. But it's just not that way. It's I think it's pretty much, you know, it's just everywhere, and we just, you know, when we gather too much or whatever like that, or there's more people, it just gives us a bigger target. But anyway, I'll let our medical community weigh in on that.
Kathy, you want to field that one?
I think the governor's right. Exactly. I think he's hit it on the target. Certainly some of those are from the nursing home. That was an early situation. There's several others in the community. This is a virus that is easily transmissible. It is in communities. As we know, from nationally, we are detecting a small percent of the virus that's out there because so many people can have a mild disease, et cetera. So we just need to all take the right protection measures and work together to do that physical distancing. You know, I think what I've been hearing from Mon County and the health department there is that they've been really having a lot of good work with their businesses, and that their businesses have been very supportive and actually appreciated the clear parameters, and that they're working well together, and the community is really coming together to do that well.
And if I could just add one other thing, that I think any part of West Virginia that interfaces with other areas that have more activity, and so Washington County, Washington, PA, does have more activity, as does Pittsburgh. Just like in the Eastern Panhandle, the Baltimore, Washington area has more activity. So we're always going to see those parts of the state have a higher susceptibility toward having more activity, just because of that juxtaposition as well.
Okay, thank you. Time for one more question. Let's go to Bailey Pace with WVVA.
Good afternoon. My question is, why hasn't West Virginia moved towards automated tolls instead of having people touching money and interfacing, which, as you know, can spread the virus?
Bailey, let me just start off by saying, you know, there's a lot of information out there from our medical community in regard to the tolls and in regard to people taking money and all that kind of stuff. And I think maybe Kathy, you can. I remember I asked about that early on and said, these people, you know, are these people not exposed more than anybody? And I think it was Kathy. I'm not sure exactly who answered that, but there's a good answer to that.
Either Claire, I can speak to that. Clearly, that's a group that we want to make sure. The important piece is when you're handling things that you don't move your hands to your mouth, and that you are good hand washing in those kind of settings. That's how it gets picked up, et cetera. So it's really important that our toll booth workers really have good hand protection, good hand sanitizer available, and do those measures. This is just a critical piece. Clay, do you want to add some further information around that?
No, I think that you bring up an important question, and that is not only for our toll workers, which is important for them particularly, but also for everybody. We're handling money all the time and passing it back and forth. So I think that, you know, this pandemic will bring up a whole bunch of different kind of questions. And I agree with Dr. Slemp here that we want to make sure that we are training people effectively to do that. There's also probably a good opportunity for people to wear a mask when they're in the toll booth, just from the CDC's guidelines, and that's probably a good practice. And just like that, we have spent time to help instruct people that work in stores and other essential businesses. We want to also help train people that work in the toll booths. But I think that as this sort of unfolds, the issue about paper money versus other kinds of electronic currency, I think that becomes an important opportunity for all of us, not just in West Virginia, but across the world.
And let me add.
Is the mask that Dr. Marsh was talking about really is the face coverings with that piece. It's the cloth face coverings.
And let me add one more final component of that is we are researching the ability to do it electronically, where people could pass through and we've just not been able to get across that bridge yet.
All right, Governor, back to you.
Well, I really don't have anything to add today. Normally, I've got a lot to add. Again, I salute our National Guard in every way. You know, beautiful rain coming. You know, as I came in, I had rain all over me and everything, but it's kind of a little bit of a gloomy day out there. But we surely need the rain, and I just thank everyone for staying the course and urge them, please continue to do so. We got a lot of people putting in a lot of licks and doing great work, and it's tough. It's tough stuff, and it's tough for every one of us. So just hang in there and keep doing it, and we're going to get there.